Many questions are being raised about the precautions and protocol that was being used at Texas Health Presbyterian Hospital. Brianna Aguirre is a nurse there and cared for her friend and co-worker, Nina Pham, after she began to get sick. Brianna is with us exclusively via Skype as a precaution, along with her attorney, Bob Kelly. Good morning to both of you.
Good morning.
Good morning, Matt.
Brianna, let me start with you. You've been a nurse for about 7 years, the last 3 of those years at Texas Health Presbyterian Hospital. How would you describe the caliber of the care at that hospital prior to Mr. Duncan walking into that emergency room?
We have a large, wonderful facility. We deliver excellent care that is top standard in this country. People fly in from other countries to have surgery. We have world-renowned physicians. We're a premier facility. A wonderful place to work, voted as the best place to work many times.
However, after Mr. Duncan arrived at the emergency room there, and by the way, you were there when he was brought in that second time, your opinion started to change dramatically, didn't it?
Yes. I can no longer defend my hospital at all.
Tell me why.
They should have... I believe that they should have known that they were not handling this well, this Ebola crisis. They should have known that it was getting out of hand, that they should have called in more help, even to make a public plea and say, help us, help us get the supplies we need, help us get the nurses the education and training they need. Anyone. We're not handling it well. And I watched them violate basic principles of nursing care, of medical care.
Let's talk about that moment when Mr. Duncan comes to the emergency room. I may have seen too many movies, Brianna, but I would imagine when you have a possible Ebola patient walking into an emergency room, given all the attention that had been paid to the Ebola crisis in West Africa and the fear of it coming to the United States, that it would be some kind of code red, that there'd be a lockdown, that emergency protocols would be put immediately into place. Is that what you experienced?
Well, first, I think we all have been watching too much TV because we never talked about Ebola, and we probably should have.
You never talked about it prior to Mr. Duncan arriving?
No, we never had a discussion. They gave us an optional seminar to go to, just informational, not hands-on, and it wasn't even suggested that we go. It wasn't. Something that they said, you really should try to make it. It was, I believe, only offered once, if not twice. We never were told what to look for. And I just don't think that any facility in this country is prepared for that at this time.
So when Mr. Duncan came to the emergency room, a possible Ebola patient, where was he placed? What kind of procedures immediately kicked into gear, if any?
First, let me say I was not a nurse that cared for him, and so I only know what my coworkers told me, people that were in direct care of him, people handling his lab specimens. I was sitting next to the doctor who was in charge of his care that day, and all I know for sure, without any speculation, without any, without being misleading here at all, is that he was put into an area where there are up to 7 other patients. We took probably around 3 hours to make our first contact with the CDC to even let them know that what we had as our suspicion. There was no special precautions other than what we know in the medical industry to be, basic contact precautions and droplet precautions. There was no special gear. We were unprepared in the sense that we did not know what to do with his lab specimens. They were initially mishandled, and that's what the lab technician told me. And it was just a little chaotic scene. Our infectious disease department was contacted to ask, what is the protocol? And their answer was, we don't know. We're going to have to call you back.
And that's the infectious disease staff that is supposed to handle a situation like this.
There's in my eyes, they're supposed to be prepared for the what ifs. They're supposed to be prepared about if this ever entered our country, and to be on the top line of being prepared and having policy in place and making sure we know it. My department in the emergency department has not even had an educator for about 8 months now. There has been no one in charge of making sure we're up to date on any policies, any procedures whatsoever.
I just want to make sure I understand this setup. So Mr. Duncan is being held in this area with up to 7 other patients not far from him. Healthcare workers are moving in and out of that area freely. No precautions being taken to prevent someone who may have come in contact with Mr. Duncan from then moving on and coming in contact with other patients.
Right. That same nurse caring for him was caring for up to 3 other patients. Of course, we perform hand hygiene in between patients, but she was not wearing anything close to what we're wearing now to care for Ebola patients. And so, in retrospect, she had a lack of personal protection, herself going in there and caring for other patients at the same time. I
want to talk to you about the protective gear that you initially wore. You did care for Nina Pham, your colleague who contracted the virus, while she was caring for Mr. Duncan. And you described to me on the phone the equipment you were wearing. There was a shield and a mask, and there was some kind of a gown that covered your arms. You wore gloves and booties over your shoes. But there was a glaring difficulty or problem. There was a gap in your protective gear at your neck of several inches where your skin was exposed. Is that true?
Just to clarify this very complicated story, initially we were advised to wear a gown front and back. By the time that I even partook in the Ebola situation in my hospital, we were already wearing what I guess would be hazmat suits. They were Tyvek suits. They were DuPont suits. And it was basically, just like you would have in a snowsuit or any hoodie, it would zip up to about here. And then from there, it would go into a hood up around my face, like this, around my whole face. And then on top of that was a mask in front of me that would go under my chin to here. So from here to here was uncovered.
And that concerned you, and you complained about it, or you at least asked the officials at the hospital why that was being allowed to happen, correct?
In fact, I'll just be honest. I threw a fit. I just couldn't believe it. In the second week of an Ebola crisis at my hospital, the only gear they're offering us at that time, and up until that time, is gear that is allowing our necks to be uncovered. And I just flat out asked several infectious disease nurses. I asked the CDC, why? Why would I be wearing 2 pairs of gloves, 3 pairs of booties, a plastic suit covering my entire body, and then leave my neck hanging out this much so that something can potentially go close to my mouth or nose?
Isn't it true that some of the nurses were wrapping tape around their throats trying to cover that space that was left exposed?
Well, when I started expressing that concern, the infectious disease nurse at that time said, we know that that's an issue, and our stance on that is that we are taking tape, and we are taking, at that time it was 4 or 5 pieces of tape, it's 1-inch tape, and we are closing that gap in the suit.
There are a lot of other hospitals in the Dallas area. Texas Health Presbyterian could have put a call out to those other hospitals saying, do you have the suits that protect the entire body? Why don't you think they did that?
I'm not in administration, and I'd only be speculating. I'm someone, I guess you would say, is at the bottom of the totem pole here. I only know what information trickles down to me, but I actually posed that same question to someone who identified himself as the vice president of our organization. I asked him, then good, you're the vice president, you can go and ask for the supplies that we need. And he advised me that he would call me back. I asked him for a contact phone number so that we could call someone more at the top of the totem pole here and ask them, for direct things that we need. Because it's not just that we were missing. And he said he will call me back with a phone number that I can reach help with. And he never called me back.
At one point in our conversation last night, Brianna, you told me that during this, what seemed like a chaotic situation, as more and more patients were coming in who were suspected of possibly having Ebola, that a member of the infectious disease staff told a doctor that it would be okay to go from one room of one patient directly to another room of another patient without disinfecting herself. Is that correct?
Yes. I'm sorry to say yes. And I mean, I'm just embarrassed for my hospital to even say that, because I expected more out of us. Anyone without medical knowledge would know you cannot go from one person with a potentially deadly virus to another patient's room without disinfecting in between. Anyone would know that. And I was standing there as an infectious disease nurse told a doctor to do just that.
There were also rules that were contradicted overnight. At one case, a patient with a preliminary negative test for Ebola, the nurses wanted to move that patient out of a room. They were told under no circumstances should that patient be moved until a final determination of whether that patient had Ebola. Then the very next day, several other patients who had preliminary negative tests were treated very differently.
That's right. Like you're saying, I worked 2 consecutive days in a row. The first day we called and said this patient just preliminarily came back negative. Can we move him out? We posed the question if it was early enough to say you don't have it and, you can now come out of strict isolation. And they said no. They said they must maintain under strict isolation until the final result comes back and until it says they are negative. And the very next day, we had 2 preliminary results that said that these 2 patients were negative, and they immediately told us to move them out of isolation because we had other patients coming in. And I stood with 2 other nurses at my side, and we said no. We said we refuse. We were just told something else the day before. How could it be a different story now? And we said we refuse. We said if you want them moved out of strict isolation, you can gown up and put on whatever suit, and you can come in here and move them yourself. And they did not do that. They told us that we didn't need to wear the full suit with them anymore. They were negative. They told us that we now only had to wear a gown and gloves. I asked them, why would I need to wear anything if they've been proved to be negative? They had no answer for me.
So one day they feared the worst with those patients until there was a final determination. The next day they were willing to move them around the hospital without protective gear.
And in fact, they did move them. I refused. I was not part of moving them out of there. I refused, and so did the nurses I was working with at the time. The oncoming shift came in and did move those patients, and they were lied to. I honestly believe. I don't work for the CDC. I'm not a doctor, and I don't know if their actual protocol changed overnight, but they lied to them. They said those patients are negative. They didn't say preliminarily. They said you are safe to go move them without personal protection equipment because they are negative. And they moved those patients down the hall, the general hallways, without even so much as a mask on their faces.
What about the materials that were used in the treatment of some of these patients and suspected patients? Was it properly disposed of? You told me that there were waste receptacles in hallways just outside the rooms where suspected Ebola patients were being treated, and that the materials were placed in those receptacles and people walked past them hour after hour.
That's correct. There was garbage containers inside the rooms, outside the rooms, and we as nurses had said, there are dirty items up and down this hallway. No one can just come in and out of here. And the CDC, our infectious disease control nurses, they had been up and down that hallway where there was garbage piled to the ceiling without so much as even gloves on, without so much as even having their feet covered, and then just walking into other general areas that are supposed to be clean. And there was no one to pick up our garbage. For the 2 days I was there, inside there, they had no one to pick up the garbage. It was literally piling high to the ceiling, and that's after we already filled up the room that they had designated as the garbage room. It was full.
Brianna, I mentioned, worked at this hospital and have worked there for 3 years. You love your job. You're not a union member. In Dallas, there isn't that nurses union. You're now saying things that are going to make a lot of people at that hospital look very, very bad. Are you worried about the fallout here? For you personally?
And I just want to say that I'm sorry for my coworkers. I know that a lot of you will be proud of me right now, and I'm sorry for those of you that are not. But what I'm doing here is not wrong, and I don't believe anyone can argue that. And I'm very concerned about losing my job. It's the best job I ever had. I travel a great distance to work there. I don't live close to that hospital. I'm the breadwinner of my family. I'm terrified. I'm just like any other, the majority of middle class, working class people. I'm just a couple paychecks away from not being able to pay my mortgage, and I'm terrified about that. I don't know about my future there at that hospital or at any hospital.
Bob, does she have any protection?
Well, Matt, as you know, we're doing everything we can to protect her. She's what would be commonly known as a whistleblower, and we have a history in this country, these companies, when somebody comes out like this and blows the whistle on what's really going on, of retaliating against them. So, she's got a 7-year-old daughter, a 10-year-old daughter. She's the breadwinner in her family. And our law firm is doing everything we can to protect her at this point. But it's my hope that after the American people hear today what's going on at that hospital, that the country will come behind and support her.
Brianna, finally for you, you're in that 21-day period where you're monitoring your temperature a couple of times a day. Although, as I mentioned, there are no restrictions placed on you moving around right now. But if, and I don't, this is hypothetical, if you were to start to experience symptoms of Ebola, Texas Health Presbyterian Hospital would be the recommended hospital for you to go to for treatment. How would you feel about that?
I've played that situation out in my head, and knowing what I know, I would try anything and everything to refuse to go there to be treated. I would feel at risk by going there. If I don't actually have Ebola, I may contract it there, is how I actually feel. And I would do anything to refuse to go there.
Brianna Aguirre and Bob Kelly, thank you both very much. I appreciate your time this morning.
Thank you.
Thank you, Matt.